Well, why don't we get started? Once again, I want to thank everyone for joining us for these weekly Smilow town halls. As you know, we started this now almost a month ago in an effort to keep you appraised of the many changes that are going on in response to the COVID-19 pandemic. And really on behalf of Lori Pickens, Kevin Kingsley, and Kim Slusser, we're grateful that you've taken the time to do it, and more importantly, incredibly appreciative for all the work that you are doing. I want to just share with you the agenda for today's town hall, some initial introductory remarks, and then we'll hear updates as we typically do from Kim Slusser and Kevin Billingsley, but we're very fortunate to have two of our other leaders in Smilow joining us, Tracy Carafino, who is the Director of Patient Services for Smilow Inpatient and the Extended Care Clinic, and Karen Adelson, who is Deputy Chief Medical Officer and Chief Quality Officer for Smilow Cancer Hospital. I'm also very pleased to say that we have a special invited speaker to join us, Professor Lori Santos. Dr. Santos is a professor of psychology and the head of Silliman College at Yale University. And in addition, her work as the director for the Comparative Cognition Lab has taken us, really informed us greatly in the science of wellness. And we'll be hearing from her as we think about really how we care for our patients and care for one another. And then finally, as we often do, we'll turn to questions and answers from our attendees. Again, a very busy week that some of our leaders will tell you about in terms of success of moving our inpatient units and continue to refine that. Work now in effort to meet the demands of the potential increase in census of COVID-19 patients to look at what we may need to do in transitioning out some of our ambulatory units within Smilow Cancer Hospital, as well as work that's going on with consolidating some of our care center units as well. A great deal of work to expand COVID-19 testing. And I will tell you the number of tests available now is much greater than it was a week ago. An increase in the availability of rapid turnaround testing, that is 1 to 2 hours, 6-hour tests, as well as tests that would come back in 2 days. And I think that additional testing will allow us greater latitude to both assess patients and staff. A lot of work to go on to protective equipment, a great deal of work that was reported by Pat Kenny, and we'll probably hear more about that and answer questions on that. As well, our multidisciplinary disease programs are continuously looking at how we make sure we provide the best cancer care to our patients despite this pandemic, and a great deal of work there. As always, we want to communicate to you, and I want to thank Renee Gaudet and others who are sending out the daily emails, and also our leaders on the call today to keep you informed about our work. And I'll tell you in a moment about the work that's going on to inform our patients and families. Also, a lot of work on our clinical research operation. For the most part, we have put a pause on our clinical trials enrollment. That is certainly going to be a temporary pause, and we'll likely hear more about that both in our daily emails, as well as perhaps we'll bring that on to a town hall in the coming weeks. As well, many of our research laboratories have gone into pause during this, but one thing we're looking to do is to figure out how to engage our research community to think creatively of what we can do together. We have a lot of smart people. I think there's opportunities to build new teams, new coalitions, new grants during this pause, and there'll be more to follow on that effort. One thing we always want to do is keep our patients and families informed, and I was so pleased. Last night, we had our first digital patient family forum. We had about 500 attendees online. We've actually had several thousand now look at the recorded update. I think it was really informative. The feedback was great. Beyond Kevin, want to thank Bonnie Indek, Jeremy Kortmansky, Maureen Rauchi, Tara Samf, who as Chief Patient Officer really helped lead this, and Maggie Zampano, who all of whom I think gave great insights and really gave tremendous assurance to our patients that we are absolutely committed to providing exceptional care during this time. Let me now turn it over to Kevin and Kim to give their updates.
Hi, good evening, everyone. I always like to take a moment just to, again, just express my appreciation every week. It is just amazing the response of our teams, every single employee, and just how everyone is rallying together to take care of our patients and each other during this time. Every person that I interact with just, again, just humbles me and makes me so proud to be part of this team. I always give in this town hall our response team updates. So again, Smilow has a COVID-19 response team of over 60 individuals, leaderships from many different departments and disciplines. And I always like to give an update from the previous week. Kevin's going to give a little bit more details into some of the new activities that we've been focusing on this week. And I really want to save time for Karen and Tracy to really highlight a lot of the inpatient work. So I'll just be very brief. Since the last week that we've met, we've had 4 new work groups. We have 5 in progress right now, and we have completed 21 work groups since we started our response team. Again, action items are things that come up that elevate to the response team, and either we can do some quick fixes or we have to elevate those to our health system and university leaders. And we've had 22 new issues that we needed to address over the past week. And so far we have completed 30 since the initiation of our response team, and we have 17 in progress right now. The work groups, the newest work groups since last week are, you'll hear Kevin talk more about our Smilow Rapid Evaluation Clinic, where we are now going to be able to do some additional testing for our oncology patient population for certain indications. We also had a work group looking at how we were going to manage patients from what are now being considered hot zones in our country, and how we can keep our current patient population safe, our staff safe, but yet provide the appropriate access when needed to either current patients that we're taking care of that live in a hot zone or new patients seeking care. And that work was completed, and we will be sharing that communication more broadly in the upcoming days. There was also a work group that was started regarding our COVID positive patient population. As COVID continues to spread across the state of Connecticut, our oncology patients are now being tested for COVID more often, and we have a larger population that are COVID positive. So we've created a surveillance report so we can see the patients who are due into our clinics, due in for radiation treatment and infusion treatment, and be able to see if they have a pending test, a negative test, or a positive test. What we realized this past week is the report was very helpful, but we needed to create some more coordination of care, some more support around that patient population to help the patients and help our care teams caring for those patients so appropriate decisions could be made. So we have a work group right now looking at that to develop that care coordination team to support those patients currently being tested. And then we are also looking at a nursing staffing work group where we really have to be planning ahead. That's what we're always trying to do, is plan ahead to take care of our patients and to take care of each other. And we know that the future is unpredictable, and there may be times where we have to work a little differently. So we have a wonderful group of nurse leaders that are very talented and will be working on creating some new models of care delivery to meet those patient needs in a time where we may be challenged by staffing. So that group was just launched today, and looking forward to their work over the next week. I want to turn it over to Kevin now to talk a little bit more about the activity over this past week. Thank you.
Thank you very much, Kim. Could I have the next slide? You know, I, like Kim and Charlie, I want to extend my really very heartfelt gratitude and admiration for all of you who are working with us to navigate through these very rapid changes and keep patient care number one in our hearts and in our minds. And I just need to take a minute to reflect as a relative newcomer to Smilow and the Yale Cancer Center, how impressed I am. You know, the mark of a great organization is the ability of teams to come together and work effectively across boundaries, across disciplines, across specialties. And I've seen that in such a powerful way over the past few weeks. Nurses, physicians, advanced practice providers, folks from operations, physical therapy, palliative care, social work, all coming together very quickly to solve problems that are unfolding in a very dynamic way. And it has been truly inspiring. So with that as a bit of a preface, I want to take a minute to highlight one of our key priorities as we're kind of working our way through this very difficult time. Our number one goal is to protect our patients as they come into our center and into our care centers for care. And our teams are ensuring patient safety as we always do, and paying particular attention to reducing the risk of COVID-19 exposure through a number of mechanisms and interventions. First off, as Kim alluded, one of the things that we are really proud of that Lisa Barbarotta and her team have stood up in the past week is what we're calling the Smilow Rapid Evaluation Clinic. This is a brand new clinical service that was created in response to this crisis. This provides a safe, enclosed space and intake area for our cancer patients who have symptoms that are potentially concerning for COVID infection. While they may not have the infection, they may simply have a treatment-related toxicity or symptom. It gives us a secure place to see people away from the risks of the emergency department in particular. And we have obtained approval from the health system to perform what is called rapid testing in this group of individuals, in which we can take a COVID-19 test and get the results back within 2 hours. So we know very quickly if we need to escalate care for COVID for one of our patients, or if we simply need to manage their symptoms or toxicities. Everything that is going on throughout our network under Ann Chang's leadership, as well as Dr. Sarah Mughalian and a number of others, is we are doing everything we can to maintain access, but in some cases we are consolidating clinics so that patients continue to be treated by fit healthcare providers in a secure environment. And again, every effort is made to keep care close to patients' homes, but safety is number one priority. We've also developed a series of guidelines to help direct our providers and make sure that we are putting the appropriate safeguards and guardrails in place as patients come to us from other sites around the region and sometimes around the country that may be COVID-19 hotspots. And although we are committed to providing care for all, we are mindful of the fact that we need to be very meticulous about allowing folks into our system who may be asymptomatic or low-grade carriers of this infection. So safety number one, and we're making great progress. I'm next going to have Dr. Karen Adelson and Tracy Carafino provide some additional detail on a number of our inpatient programs.
Hi, can you hear me?
Yes.
Yeah, okay, I was having some internet connection issues. If you will indulge me for a second, I want to share with you a description of the work of a writer whose work has really inspired me throughout my life, and who, as through this crazy time of COVID, the title of one of her collections, Enormous Changes at the Last Minute, has just been a recurring stanza in my mind. Grace Paley is an author who I actually named my daughter after. And she wrote brilliant short stories that I think have lessons that we can bring with us into the work we're doing every day. She wrote in 1974 at a time of dramatic social change across the country. And she gave voice to characters who traditionally had been neglected in literature. So women, mothers, single friends, political activists. In one incredible story she wrote about three friends coming together to remember the life of one of them who was dying of ovarian cancer. And she wrote at a time when the people were panicked about the nuclear bomb and fighting the Vietnam War. And really what she brought was tremendous humanity to everyone that she represented. And as I think about how we're doing here at Smilow, banding together to advocate for our patients with cancer at a time when the world is entirely focused on nothing but COVID, I know that she would approve of what we're doing and what we're seeing every day. So as I think about how we have all bound together to care for these patients and make these enormous changes at the last minute, I just want to think about some words that I'm so privileged to witness every day in our teams. So the amount of flexibility, creativity, solutions, self-sacrifice, coming to work at a time when it's scary and our own health is at risk, the teamwork, the sharing, the dedication, commitment, the caring, true bravery that we see every day, problem solving and togetherness, trust, vigilance, and coping. I'm so proud of our teams and so honored to be part of it. And now I'll show you some of the work in the next slide that we've done. So, we are very focused on protecting our patients and our staff. Next, advance. So we relocated 3 units to the St. Raphael's campus. We moved the extended care center to EP1. We're soon to open our rapid evaluation clinic for patients with fever and COVID-like symptoms. Keep advancing, sorry. We are utilizing telehealth for consults. We've updated our PPE guidelines constantly to evolve and give the best protection to our staff. And we've created work at home guidelines for two closely related but separate institutions that really didn't previously have policies for that. Next slide. So there's been major changes to the oncology service. As many of you know, our residents have all been pulled to care for actually patients on our former units at York Street campus in the new ICUs. And so we've had to adjust. Our fellows are filling in and doing tremendous work during the days. Each fellow is doing the work of what an intern and a resident would have done in the past. We've had to create solutions for night coverage, and we have volunteer people who are working, doctors who are working as hospitalists and fellows as well, who are covering our shifts at night, again, doing the work that in the past would have been done by 2 or more people. And our wonderful APPs have band together to provide phone coverage support for our practice, which was previously done by the fellows who are now, again, working very intensely on our inpatient units. Next slide. Can you advance this? So, sorry, I had too much animation. Go back. Okay. So one of the questions that has come up now that we have patients spread across 2 hospitals is, where do we send a patient who needs to go to the ED? So the first thing I want to remind everyone about is that our extended care clinic is now open on York Street in the East Pavilion on the 1st floor. And that is the place where any patient should go who does not seem to be having an absolutely emergent presentation, because we know that they are less likely to, admit patients to the hospital and more able to stabilize them from an oncologic symptom perspective. But if the ECC is closed or the patient is likely too sick for the extended care center, we are making the recommendation that solid tumor patients be directed to the St. Raphael's campus emergency department, because if they do need admission, that's where they would be admitted to, is to our Verdi units at SRC. And liquid tumor patients should be directed to the York Street ED. If there is not enough room on North Pavilion 11 when they get admitted, they will then be transferred back over to SRC. But the basic principle: solid tumor, send them to SRC ED; liquid tumor to York Street ED. Next slide. So the other thing just to mention is that our volume on the inpatient service is down. And as somebody who has attended on this service a lot, where the patients are sick, we have very few unnecessary admissions in the recent historical period. And it's very concerning that our patients are likely staying home for fear of COVID when they may need hospitalization. And I think we're worried that patients may end up getting very, very sick without seeking inpatient care. So we're working to develop reports to identify patients who may have COVID as well, and enhance care management services for that population. But if you are taking calls from patients, I think our threshold may be too high in preventing them from coming in and being evaluated. Next slide, I think, is Tracy's. Yep. Next is Tracy Carafino.
Tracy, you're on mute.
Okay, sorry. Good evening, everyone. I would like to start by I'd like to thank our Smilow leadership, Lori, Charlie, Kevin, and Kim, and my physician partners and nursing peers, because I think that the state we're in, we've always been planning ahead. So they've tried to stay a couple steps ahead, even though it's really hard in this crazy time and it's hard to actually plan. But they've done a phenomenal job in trying to keep us ahead, so we're not reacting, but being able to plan a little bit. And I think that has positioned us in a much better place than a lot of organizations or other services are. So I give a great shout out to our leadership. And so when we talk about adjustments, I think, as Kevin and Karen both mentioned, everything that we are doing is being driven by our commitment to patient safety and minimizing risk to our patients. At the same time, we are just as concerned at minimizing risk and decreasing exposure for our staff, all of our staff. And so each day there's work done looking at where staff is working. Switching from North Pavilion to Verdi has actually decreased our total number of beds. So there is some ability to flex staff, but we are also opening new areas and flipping staff around. So we're paying a lot of attention to which staff is working where, and also with partnering with the physicians to ensure that staffing levels can be minimized as much as possible, understanding that with inpatient practice, you can't work from home. But we are doing as much as we can to minimize that risk. I think I just wanted to point out a couple, we've talked in these forums before about a lot of the Smilow moves, but I think two things that I wanted to highlight that haven't been is Elena Ratner had worked with Dr. Billingsley around ensuring she really wanted her team to stay together and the care to stay with the nurses. So they worked to ensure that the patient would have the surgery at York Street campus, stabilize in recovery, and then come to Verdi once stabilized. And that has worked seamlessly. There's been no issues, and the patients are really satisfied. So thank you, Elena, for creating that workflow. We had stayed on York Street with a 10-bed part of 6-5 for our surgical oncology patients because of really difficult head and neck cases with fresh airways. But based on situations, I think a lot of people know that there's been some 6-5 is currently closed, and with the decrease in cases, we've opted to change that, and the surgeons have worked again with the PACU and the nursing leaders to make that same workflow happen for surgical oncology and head and neck, so that they will have surgery at York Street and then come over to Verde 4 North to do their recovery. Next slide. In all of this, obviously my role is nursing director, so I do want to spend a little bit talking about the amazing nursing leaders and nursing staff that I work with. This is actually a picture of the group that had committed to working on 6-5, so they left the rest of they were split up, the only staff that was split up. So part of them were on Verde 4 North and part were on 6-5. And yesterday when they transferred the last patient over, they were rejoined as a team. And as we've moved, we've had to shift because of private rooms and various situations, we had to switch some of who the teams are caring for. So there has been amazing leadership and amazing resiliency of staff in really stepping up to take on new patient new care, new delivery for patients they hadn't cared for. And we have an excellent Department of Nurse Educators who have stepped up and oriented them to the new environments, our just-in-time training on populations or protocols that they may not have had. And we are doing a lot they're sharing staff amongst the units to ensure that we have competencies for all the patients they're taking care of. And I might add, they're doing it with a smile. And actually, you know, they've touched a little bit today on the new clinic that we're opening for rapid testing. And, you know, we asked, you know, these are going to be all patients that are ruled out for COVID, and we asked for volunteers, and we had numerous nurses step up and volunteer to take shifts and work there. So I know that always, you know, change is difficult, and but the amount of change happening on a daily basis, on an hourly basis, is just overwhelming, yet this crew has just rolls with it and keeps going. So I definitely have to give you guys major kudos for all you're doing, and it's greatly appreciated. The last thing I wanted to touch on is, as we still continue to move into not even hitting the peak yet, we, again, as I discussed, trying to plan ahead, are looking at, and Kim did touch on this a little bit, new models of care. So a group has been charged, and we have several of our leaders working in the group to look at, if we do lose staff, you know, staff that has to be out due to their own personal issues or care, if the census becomes overwhelming, that how do we take care of these patients, looking at different models. You know, it might not be the traditional one nurse for 3 patients with a PCA. Everything's on the table. And so once again, we had a lot of volunteers, and they're anxious to get started on looking at how innovative ways to look at how to take care of patients in a pandemic. So next, I think that's the last, lessons learned. This is really focused again on the spread of COVID. And since we had the close of 6-5, and we did have 7 staff members that were working on that unit test positive, some of the lessons, we just wanted to share some of the lesson learned for other areas, takeaways, because I think there's some things that we've done really well, and some things where you can have an improvement. So we are now, everyone should be wearing masks at all times, including in workrooms. A lot of our workrooms, it's really hard to have social isolation of 6 feet. So we're still encouraging that and utilizing other workrooms. But if you should be wearing a mask if you can't maintain that 6 feet distance. The other thing is sharing of food. We're asking that people do not share food. And I know there's a lot, we've had enormous support from the community and wanting to bring, give us pizzas and cookies. And so as much as possible, we really should not be sharing food. And we have also come up with some innovative ways to share food, but not have anyone touch it. So, and then cleaning your keyboards. We started a strict rule on the units that when staff come in, they actually identify a workstation of their own. They wipe it all down, and then they put their name, and it's that workstation for the day. And then when someone else comes in, they do it, because, you know, as everyone knows, this virus can live on surfaces for quite a while, and keyboards are something that are frequently shared amongst many staff members. And on that note, I'm done.
Well, Tracy, thank you, and Karen and Kevin and Kim, really terrific updates. As I mentioned, in addition to hearing from our leaders, we're really very fortunate to have an invited guest, Professor Laurie Santos, Professor of Psychology at Yale. And many of you may know Laurie's work in the science of wellness has really become popularized nationally and internationally. I came to learn that her course on psychology and the good life is the most attended class in the history of Yale, and as is our frequent podcast on the Happiness Lab. And then lastly, I noticed on Coursera, she's got a series of courses of which there are 1.7 million registrants. So I thought, who better to talk to us about how we care for each other? So Professor Santos, thank you.
Thanks so much. And thanks so much for having me. I feel like anything I can do to help folks in the healthcare profession, especially folks who are kind of incredibly courageous on the front lines and kind of tackling, you know, other hard problems like solving cancer in the time of COVID-19. It's just incredible what you're all doing. And so I just have so much gratitude. So thank you for your courage and for all your hard work. What I was going to do today is just kind of walk through the ways that you can be taking care of yourself during this kind of crazy, challenging, unprecedented time, and also some tips that you can use to kind of help your patients, who I'm sure are also going through their own periods of uncertainty and fear and panic and all of these things. And I'm also hoping to kind of go through some of these tips relatively quickly, because I also want to just hear what questions you all have, which we can either do in the chat, or I feel like Charles can help us figure out how we're going to ask questions and stuff. But I definitely want to make sure that we're getting to exactly the questions that you all have. But if I had to kind of give my quick tips for things that you all should be focusing on, I think one thing to, you know, just say obviously at the outset is that this is an unprecedentedly scary time, you know, in our economy, in our politics, and especially in healthcare. And we need to kind of acknowledge that and sort of validate it. Like, it's okay to be scared. It's okay to be anxious. It's okay to be feeling all the things that we're feeling, but it's worth remembering that we can control our reaction to this situation. Even the most awful situations, the science suggests we have some ability to control our reactions to the situation. And we have lots of very simple interventions that we can be taking to protect our mental health. And I think this is really critical. All of you are talking now about the things that you're doing to protect your physical health in the time of COVID, you know, incredibly important, social distancing, you know, PPE, like washing your hands, all this stuff. But we often don't know the kinds of things we can do to protect our mental health. And that's the kind of interventions I want to give you today. You know, what's the hand washing to prevent anxiety? What's the hand washing to prevent this level of panic, and so on? And so one of those interventions that I think is really critical is that we need to make sure that this time of social distancing doesn't become a time of social isolation. You know, all the Zoom meetings that we're on every day are a little bit more exhausting than, you know, walking through the wards to see your patients. And I think that's a real thing. But the good news is that this form of connecting through technology is really the best hope we have to prevent loneliness, which is its own kind of silent killer, especially in this time where we need our immune function boosted up. You know, research suggests that loneliness can be as bad for your physical health as smoking something like 15 cigarettes a day. And so we don't want to fall prey to that. And we want to be able to do what we do naturally in a crisis, which is that we all want to come together and help the people who are hurting. You know, especially the people on this Zoom call are the people who are ready to rush in when there are others suffering. And so you want to be able to find ways to do that. And the good news is the research really suggests that the kind of thing that we're doing right now, even though we're not in person, but we're talking in real time, that has a lot of the same features of social connection that we really get out of in real life social connection. And so even though it can feel like a little clunky and it has some startup cost and stuff, it's doing a lot of the same good work. And I think that's one thing to remember. I think, you know, I've heard lots of healthcare professionals who are kind of beating themselves up that they feel like they can't give the same kind of care virtually to their patients. And it's kind of, you know, like they're kind of feeling incredibly guilty about this. But the fact of the matter is that you can, and that sometimes the social distancing that we're facing and the kind of technology we're using, we can actually use to give a little bit more intimate care in a weird way. You know, your patients might, you know, see the inside of your office, or if you're working from home, you know, see your bookshelf behind you and so on. And those tiny moments of connection are actually quite powerful. You know, maybe some of you are doing the same with, you know, with your patients in their house, you know, you're seeing their dogs or something like that. Like, harness those and use them, because what they're allowing us to do is have, you know, it's kind of like the little water cooler conversation. It's the sort of slight intimacy, and we can get that over technology in a way that you might not expect. And so find ways to have more of those informal interactions with your patients, but then also just in real life. You know, when you've had a tough day at work and everything feels really stressful, you kind of just want to plop down and scroll through social media or click on Netflix. This is the time to be very intentional and actually turn on that Skype window to talk to a friend or kind of connect with someone, even if it's by phone. Like, we need to be reaching out more than ever. So that's kind of tip number one. Tip number two, I think, can be incredibly powerful in the healthcare field. And it comes from recent research on the power of social emotions. Our emotions, we sometimes want to tamp down in a crisis. You know, we don't want to feel anxiety. We don't want to feel fear. But the research suggests that our emotions are there for a reason. And if we can harness the right ones at this time, they can kind of give us strength in a way that we don't expect. And one of the emotions I want to focus on today is the power of compassion. It's not an emotion that we think about a lot, and it's one that's actually distinct from the other emotion that's related, which is empathy. And so empathy is a helpful emotion where you're kind of feeling the pain of other people, kind of feeling their suffering. But it turns out that empathy and kind of like digging in on empathy and feeling it a lot is one of the things that can lead to a lot of burnout, particularly physician burnout. When you're facing the suffering of folks, if you're an empathic person, you're going to take that on. The power of compassion is it allows you to be action oriented. And compassion is sort of an affiliative emotion where you kind of want to take action and help. But cultivating that allows you to be there for the suffering of other people, kind of dive in when you need to sort of courageously jump into a problem where someone's suffering. But it allows you to do it in a way where you don't experience that other person's suffering. You can kind of dial it back. And there's lots of fantastic, interesting research on this there's some work by the neuroscientist Tanya Singer that when you get folks, particularly in a healthcare setting, when you get folks to kind of dial up their compassion and you show them videos of patients in suffering, before the compassion training, people would see those videos of people in suffering and experience lots of negative emotions, as you might expect. But people who do compassion training actually experience those videos with a positive emotion. They report feeling affiliative, like they're ready to go and ready to dive in and help them, which is quite powerful. And so you might be thinking, how do you compassion sounds awesome. How do you turn on compassion? And like other things, it tends to be a practice. But one of the practices we know can boost compassion, and it can do so quite quickly and without that much of a time investment, is through practices like meditation, a specific kind of meditation known as loving kindness meditation, which sounds very cheesy and not scientific, but neuroscientists have done work on this. It's a form of meditation where you really try to think about and feel compassion for people in your life. So the mantras that people tend to use in this form of meditation is to think about someone you really care about and express compassion. So think the phrases, may you be happy, may you be safe, may you care for yourself joyfully. You kind of go through different people in your life. And what people self-report is this allows you to kind of build up your muscle of compassion. You can kind of turn it on and off at will, which is quite powerful because that means you can kind of turn it on when you need it, but then when you go home at night, you can kind of shut it off. And that's another thing that the neuroscientific work suggests, that this practice over time really allows you to kind of scale up your compassion as needed. That same neuroscientist, Tanya Singer, who did some lovely work with Buddhist monks who do a lot of this compassion meditation practice. So in some sense, they're experts, but they can go in a neuroscientific scanner, and Tanya Singer can look at regions of their brain that sort of react empathically to other people's pain. So these are pain regions that kind of experience pain when you're watching other people. And these Buddhist monks with their compassion training can do the following. They can be told, scale your compassion up 10% for this video, or scale your compassion up 75%. And she gets linear responses in these regions of the brain, depending on how much they're scaling their compassion. So experts in this form of meditation can really kind of control it to some interesting extent. But even though I think you're not gonna drop everything and become Buddhist monks, the good news is that a simple 2-minute, 5-minute practice a day, people report that they're reducing symptoms of burnout even within the first couple weeks or the first month. So this can be a really powerful technique. So that's kind of intervention number 2, is find a few minutes in the day to kind of work on your compassion. It can really pay dividends in terms of giving you the strength you need to get through this tough crisis. The third thing I would want to bring up is one that you as medics know, which is that you need to kind of be worried, or you need to be paying attention to what your body is doing right now. And I mean that in the sense of kind of monitoring the responses of your autonomic nervous system. You know, so many of us right now are in complete fight or flight mode because we have this awful threat, you know, a really real threat. Our anxiety is not kind of out there for no reason. It's based on something that's really real. But of course, it's not great to be activating your sympathetic nervous system nonstop and for threats all the time, all day. Like, not great for your immune function, not great for your digestion, you know, probably leading to a lot of the things you all are trying to figure out in oncology when you kind of ramp up our sympathetic nervous activity. And so we kind of need to give that system a break and activate our parasympathetic nervous system, that sort of rest and digest system that can come in and help us chill out. The good news is that even though it's hard to kind of hack your autonomic nervous system, nature really does give us one way to do that, which is through our breath. And so the act of slowing down your breath, you're taking these big, deep breaths, particularly deep breaths where you go into your belly. You know, what you're doing is you're kind of moving around the activity of the vagus nerve. And that is enough to tell your parasympathetic nervous system, oh, we can't be running away from a tiger right now because we're breathing really slowly in our belly. And that can give you just a moment where you're kind of deactivating this fight or flight system. And yet again, it's another one of these interventions that I think all of you can do. You know, imagine if you gave just 3 really slow belly breaths after each patient call that you have, you know, or after each time you read another scary statistic about COVID or PPE or something. The idea is you're just kind of giving your body a way to reset that threat level at least a little bit, and it can really have a much more powerful effect, or kind of a big effect for the amount of time it actually takes to do that. So that would be kind of super fast tip number 3 of like, find ways to kind of chill out your sympathetic nervous system through using your breath, and particularly these deep belly breaths. The 4th tip, which is the one that's harder because this takes a little bit more time, but I think it's really critical, is that in this time where we're all quite frantic, it pays to kind of get back to the basics in terms of our mental health and in terms of our physical health. What do I mean by get back to the basics? I mean prioritizing things like sleep, like exercise. You know, the first things that go out the window when things get really frantic, but those are the things that we need to be doubling down on because they're the kinds of things that help our mental health more than we expect. So there are studies suggesting that a half hour of cardio in the morning is basically as good as a prescription of Zoloft for reducing depression symptoms. And there's similar effects for anxiety. We also know from sleep, of course, that sleep regulates your mental health function much more than we expect. And of course, you all know that both of these are good for protecting your immune function, which all of you need when facing the threat of COVID-19 and so on. The problem is that, again, as things get busy, those are the things we don't stick to, right? And so now I'm giving you permission and reminding you that those things are critically important. That if you can, you know, shut your phone off and find a way to get to bed a little bit earlier, even if it's just a half hour, those things can have a huge effect. If you can steal, you know, 20 minutes of time to like take a walk outside or, you know, do a quick yoga class or something, that is great. And we know that that can be extra challenging, especially the exercise part, if your gym is closed and Payne Whitney's closed and these things like that. But you can find ways to do that kind of thing at home. Remember, even a little bit can actually be really helpful for these functions. So that was my tip number 4. And my tip number 5, fast, before I'll kind of open it up for folks to ask questions, is just to remember, it's kind of the flip side of compassion for other people. It's to try to make sure you remember to have compassion for yourself. You know, I have lots of friends who are in healthcare, and I hear them, you know, basically talk about the frustration of, you know, we can't solve this thing. We can't make there not be a pandemic. We can't fix all the problems structurally that are happening in healthcare right now. And those of us who, you know, have been able to fix a lot of our patients' problems, or at least be there for them, are limited in the physical ways we can do that right now. And all of that can be incredibly frustrating, like, to validate that these are real issues. But I think what happens sometimes is then, in addition to the real issues we're facing, we also beat ourselves up. And so no more of that. Self-compassion is the rule of the day. Like, we need to have patience for ourselves in the face of this. Some days are going to be better than others, and that's okay. That doesn't make you a bad doctor or a bad clinician or a bad person. We just kind of have to give ourselves that benefit of the doubt. And that's true if you're working in teams as well. Like, if you can embody a little bit of self-compassion, that's going to help your teammates remember that they need to do that too. In your families, that's going to remember to help your spouse know that, he or she is potentially going to be okay in the face of this too. And I end on the self-compassion note because there's lots of research suggesting that, we catch other people's emotions too, right? You must have seen this in teams. If you have one team member who's panicking or one team member who's embodying calm, that can transmit to you, that can transmit across a whole team. And so if you want to help the mental health of your patients, if you want to help the mental health of your team members, in some ways you have to start with yourself. And starting with yourself requires a little bit of patience and a little bit of self-compassion. And so those are my 5 tips. As I said, I want to kind of keep time so that I can address the questions that you all are facing and what you all are seeing in the trenches. So I'll open it up, and we can do it a couple different ways. I got my chat window in the Zoom side open. I'm getting good at this from working with all my undergrads. We have to do all our stuff in Zoom now. So you can ask that way, or I think if you demute, you can probably ask the old-fashioned way too, but would love to hear any of your questions.
Well, Lori, thank you. And we'll certainly invite people to submit questions on the chat room. We did get some questions in advance for all of our panelists, but I'll start with you, Lori. I think what your advice is really so critically important, But one thing I think that's been going on this past month is we're all on adrenaline, realizing the urgency and the necessity of the response. But we also realize that we still are in a bit of an exponential phase of the number of cases in our community, and realizing the often used phrase that it's not a sprint, it's a marathon. So, realizing that right now we're responding to the need, but we know there's more time that is going to go on to deal with this. How would you recommend people pace themselves, given the fact that this isn't necessarily going to end tomorrow?
Yeah, no, I think that's really critical. I mean, I think, these interventions that I'm talking about, they help your mental health today, but they, in some sense, preserve you to have the mental health tomorrow. And this is the worst thing I think we know about, as you know, like activating your sympathetic nervous system, is that you run the risk that you're going to burn out even faster, right? So the investments that you make in, say, getting in 20 minutes of exercise, or doing a few of these belly breaths, or especially if you can squeeze, 5 to 10 minutes of a loving kindness meditation, those are investments that you're making in future you. And so I think they're critical to be doing now, because as I said, this is bad, and it's hard to imagine that it's going to get worse, but, we know where we are in the exponential curve, and, again, acceptance, validating, it is probably going to get worse. So the habits that you put into place now can be really powerful. Another thing I'll say about that is that one thing we know from the scientific research is that, it's really hard to form new habits in general. Habit formation is hard. As you know, people don't necessarily do all the good things that they should be doing for themselves. That's why, we wind up in doctors' offices in a lot of ways, right? But in addition, there are times when it's actually a little bit easier to form new habits, and really strong transitions and situations can allow us to do that. Right? The difference between working from your office and working with patients directly and working from home, the difference between working on one ward versus working on another ward, switching floors, switching buildings, those are changes that are frustrating and give us uncertainty and so on, but they also give us an opportunity to start new habits. And the science suggests if you start a new habit amidst a new situation, it's more likely to stick. That's why when you move, it's easier to start a new workout routine or something like that. The good news is that all of you are going through that change, and the change can be yucky, but why not harness it for forming some good habits, some of these positive habits that might be really helpful. And again, starting that habit now is you're kind of planting the seeds for it so that it can grow over this marathon that you're all kind of going to be dealing with in an even more intense way, perhaps a month from now, 2 months from now, and so on.
Another question that I think people would like your advice on is you've given us great advice on our own wellness, and I think it's equally applicable to our patients. But what advice would you give us as caregivers that we might help our patients? Because it's obviously stressful enough going through cancer therapy and having a cancer diagnosis. How would you suggest we advise them in this setting of COVID-19?
Yeah, I mean, I think it's, again, just validating. That's incredibly scary. You are already doing the work of having to help your patients through another scary, existential, potentially deadly situation. And now there's this other one on top of it that ends up preventing the ease with which you give them care for the first really scary thing that they were dealing with. And so it is really hard. That said, remember that you have incredible power, not just to heal with your medical techniques, but to heal with your emotion and to heal with your bedside manner. We know so much about the power of the emotions that you bring to the table when you talk to your patients, and the fact that contagion that happens. So the contagion between emotions happens across people all the time, but there are directions to it. And when you're in a leadership position, when you're the nurse or when you're the cancer doctor, you're going to be, the emotions aren't going to go from them to you. They're more often going to go from you to them. The leaders are the ones that are most easily kind of contaged. In other words, they're the ones that transmit their emotions more. People are ready to pick up a leader's emotion. And that means you have incredible power if you can, go on your Zoom meeting with your patient and just embody calm and just be like, yeah, this is a really scary time, but the hospital's working on it. We have these fantastic nurses and fantastic teams. They're doing everything they can. It's going to be okay. If you just say that, you can probably watch your patient's chest just go and you have the power to do that. That means you have to do that, which is, again, not easy in this kind of crisis. But the point is that you have tools. And if you're like me, if all of you who are in care are there because you want to help people, sometimes it's easier to regulate our own emotions, not to protect ourselves, but to protect other people. And if you know that your emotions are going to transmit to this fragile patient of yours, it might give you, the extra oomph that you need to do those 3 belly breaths right before you get on the phone. And so, yeah, so I think one of the most powerful things you can do, you can share these tips, and I think that's really helpful, but I think you can just work on it yourself and just kind of embody the emotions that you want your patients to be feeling right now. And you'd be surprised how naturally our minds just soak those things up, especially from someone in a privileged position to someone who's in a kind of learning from that person position.
That's terrific advice. Thank you. I do want to also we have a few questions as well for other panelists, and I'll send this one to both Tracy and Kim. A number of questions about PPE use and what you're using in what setting and what time and where. And it's confusing. And I wondered if you both could help clarify that for our staff. Tracy or Kim, either one, whoever wants to start.
I'll go ahead and start, and then Tracy can keep me honest. But Lori, thank you for your topics today and your hints and helpful tricks, because I think it comes at such a great time for us. And I know I'm going to take some of those back, and I really appreciate it. So PPE, this is one of I think all of our, it sits at all of our, at the front of all of our minds. We're always thinking about it. We're always wanting to make sure that our teams have everything they need to physically protect themselves. And we're living in a world where things are changing rapidly as well. So just yesterday, the Ambulatory Task Force for the Health System came out with additional ambulatory guidelines, which I think our teams have been waiting for a long time. And so with those just coming out last evening, it's going to take us just a little bit of time to catch up and make sure that our staff have everything they need and that our patients have what they need. And so our local leaders should be communicating those things. But I think a couple of the key takeaways from the ambulatory side that we were waiting on was really around how we protect ourselves when we feel there is a risk identified that we didn't anticipate. So a patient coming into our clinic and we weren't quite prepared, but now they're expressing some risk factors that we think could be suspicious for COVID. And now we have those guidelines, and we should really be making sure that we transition that the patient should be wearing a mask. Hopefully they're coming with masks on now, but if they're not, we need to immediately put a mask on the patient, ask them to put a mask. And then we should now be wearing our masks, which is wonderful, but then we should be adding eye protection, gown and gloves to our protection as soon as we determine that this is happening in our clinic. And now we have also guidelines for how to clean that room once we're done assessing the patient and making sure they get where they need to be. So those are guidelines that we did not have a week ago that we have now, so that we can clearly communicate to our teams and make sure they have what they need. In addition, Kevin talked about our Smilow Rapid Evaluation Clinic. And again, this is where we can create a more protected environment and try to bring patients who need those extra precautions. So in that setting, we will be having our staff wear the full complement of gear so that we can be doing that screening and that rapid testing. So in that situation, our team will be wearing the appropriate PPE, including the N95 mask, the eye protection, and the gown and gloves when they are caring for the patients. And again, this is our best way to, again, make sure that we're preserving our resources for the people that need it by cohorting this patient population in one clinic setting and having our staff trained to take care of these patients and minimizing risk to not only other patients, but to our staff as well. And I want to echo what Tracy said. It was amazing, the volunteers that stepped up to work in this clinic, and I'm just so thankful for those volunteers. And I'm really looking forward to this clinic opening tomorrow because I know it's going to be just a wonderful thing for our patients and our teams. So hopefully those ambulatory requirements and guidelines that came out yesterday will really help ease the confusion that our teams have been having. I don't know if Tracy wanted to add anything specific to inpatient or just in general for nursing.
I agree. I think, you know, it's a hot topic every day. And I think one of the things we've learned and talked about a lot is that everything is changing every day. And I think another best practice is we have this great resource website, which is the most up-to-date information. So I think always looking there, because if I tell you what the PPE is today, tomorrow it could change. And so I think also communicating with your managers. I know my managers are doing Skype staff meetings, and staff meetings have never been better attended because people want information, they want to know, and that way they're able to ask questions and get the best information. So I think maintaining that communication and constant, you know, connections is really important.
Thank you both. I'll put this to Karen and Kevin. You know, a series of questions about, are there more plans to move ambulatory services, inpatient services, both here and across the network? And, you know, is there more to come?
Kevin, you want to go or should I take it?
Well, we can tag team it. I can start.
Okay.
You know, the short answer is that there is more to come. Our group has been tasked with creating inpatient capacity for what we anticipate to be a rising number of COVID-related patients. Some of those patients may require intensive care level management. Some of them may just be ill hospitalized patients. But there will be a need for additional inpatient capacity, and we have been asked by health system leadership to provide that capacity in the North Pavilion Tower. You know, as such, I think many people in the audience know that we plan to move out of North Pavilion first floor, with the exception of the Smilow Rapid Evaluation Clinic on Monday. And there are plans in development to move our clinical operations temporarily out of NP4 and NP8 within the next couple of weeks. The details on those plans are shaping up, but that is the direction that we need to be going. Karen, do you want to fill in as well?
So, you know, by having such a robust network, we're incredibly privileged at Smilow to have capacity to move patients to state-of-the-art facilities outside of the main hospital that will have a lot of COVID in it, and to you know, absolutely wonderful infusion centers not super far away. And in addition, at some of those sites, there is other space that had been used by other clinical services that is largely shut down at this time. So I just want to reassure everybody that we have capacity, that all of our patients will be accommodated in the environment in which they're comfortable and used to. And in terms of inpatient, there are no imminent plans to move inpatient beyond what you've heard today. But things do change quickly.
Thank you both. We're almost out of time. I'll just pose this last question to Lori. Lori, are there other resources that people could turn to online or elsewhere to sort of think about how to address their own wellness?
Yeah, so we're doing a special COVID-19 series of our podcast right now on the Happiness Lab, which you can download anywhere you get your podcasts. And in fact, we have in some of the episodes these kinds of meditations I was talking about. Dan Harris, who's the journalist who runs 10% Happier, he's kind of a journalist who's become a meditation expert. He's given free access to all of his classes and courses to healthcare providers right now. His website is called 10% Happier. And as I said, you know, the thing I worry most about as you all think about this marathon is the burnout part. And there's just great empirical data on the power of just a few minutes a day doing these techniques. So those would be the ones I would point you to at any time. So.
Well, that's very helpful, and we'll make sure we post those things for our staff, both on this call and those who aren't able to join us. So it's 6 o'clock. I want to thank all of our speakers for providing so much insight, and particularly want to thank Professor Santos for taking time out of your day to join us. And as always, thank all of you who are on this call and are sort of moving the needle here. Many of us have had the privilege of talking to many patients, both through our recent forum and just rounding on the floors. And, you know, I think all of us in this field of cancer care, we're inspired by the courage of our patients. But a message that I'm hearing both through emails, letters, talking to patients when I rounded on the floors and in the care centers was their incredible respect and admiration for the courage of the people who work here. You know, as a point of fact, the very final question at last night's Patient Family Forum, and it was a series of questions which were, what are we doing to take care of our staff? Because they care about you as much as you care about them. And I think that partnership is certainly going to get us all through this. So I'll close the way we closed our town hall with the patients yesterday, which is it's 6 p.m. It's one day closer to the end of this COVID-19 pandemic. So stay safe, stay well, stay strong, keep up your extraordinary work, and have a good evening.
Thank you.
Thank you.